Knee surgery has evolved dramatically in the last few years. As our population becomes more active and older, such procedures become more necessary. Let's take a look at Alpha Clinic's newest innovation.
This is a standing radiograph of a patient of a right knee taken from the front.
Many patients who suffer with arthritic knee joints want to find a remedy short of total knee replacement. Alpha Clinic, based in Munich, Germany, is working to help patients with arthritic knee joints find alternative solutions.
Knee arthritis can be cured. This will probably come as a surprise to most people who listen to this. And this is no general recognition neither amongst doctors nor amongst the general public. And the fact that it can be cured is based on the potential of the body to reform lost articular cartilage.
Sometimes a form of treatment for a particular medical ailment does not apply to all those who suffer from the malady.
When we're talking about severe osteoarthritis of the knee, we're mostly looking at an older population of 70, 75, 80 years of age for whom putting a total knee is totally okay. But we have a huge population of people aged, let's say, between 35 and 65 who either are felt to be too young for a total knee replacement by the doctor or who themselves feel they should not have one and who suffer from severe osteoarthritis following previous sports injuries. And this is the ideal age group for what we call the bioprosthesis. Bioprosthesis means that with the techniques that we're applying, without the use of artificial components, we resurface the bare bone with newly formed articular cartilage.
When replacing or repairing a damaged knee, finding a solution that will last is a significant challenge.
We have individuals that we did the surgery on up to 15 years ago, and in some of these people, the articular cartilage reformed at that time is still present. In some of these cases, we had a chance to do a rescope, meaning we were looking back into these knees, and we were finding that even after such a long time, most of the cartilage that had reformed at the time was still present. So what we can safely say is that it will last between, let's say, 10 to 15 years, and it will probably even last longer if what we do as a general rule also address other problems in the knees such as axial deviations, instabilities, and the rest.
No matter how promising a medical advancement may be, patients frequently can only afford treatments that are covered by their insurance.
Well, the thing with insurance generally is that they do recognize progress in medicine and they welcome it, but when it comes to payment, then the enthusiasm sometimes isn't that great anymore. And that applies to insurance all over the world. It takes a little bit of a, let's say, persuasion on the part of the patient, also on the part of the doctors. You need to have good documentation to convince the insurance companies that this product is a predictably good product, that it will help the patient, that it saves a lot of other costs, and that it is more cost-effective than total knee replacement.
Finding solutions to improve patients' health and well-being is something all healthcare professionals strive to accomplish. For World Business Review, I'm Alba Marie, on location.
Repairing a joint is obviously preferable to replacing one. Hopefully, these procedures will continue to be less invasive and quicker on the recovery.
And now, providing much-needed medical personnel to rural areas.
Many areas in the United States are suffering from a lack of qualified medical specialists. Heyman Dougherty will now show us an innovative approach to this dilemma.